Special good afternoon to each and everyone here. Dr. C. Venkatram, Director, World Hypertension League, Southeast Asia, and Dr. S.N. Narasimhan, Vice President, World Hypertension League, Dr. V. Mohan, Director, Mohan's Diabetic Center, Dr. Mohan being felicitated by the World Hypertension League on behalf of his contribution in the field of diabetes to the globe. And when Dr. Narasimhan introduced Dr. Venkatraman and Dr. Mohan, and he said, Padma Shri, introducing the Padma Shri, which was introduced by the future Padma Shri, I think, because of your contribution. And I thought when I entered the venue, I'm in a very dangerous zone because that time, that side diabetes, this side hypertension. So we have to be very safe. So side by side, hypertension and diabetes, we have to be very careful. So that is the message. It's a very simple message. So it is, I'm really very happy to attend this program. And I thought, because yesterday I have sent a video message, and today my schedule was very tight. But in spite of that, because of Mohan's contribution, not only to the field of diabetes, the education, here educating the patient, educating the society, how to control diabetes or how to pre-diabetic stage and how to avoid diabetes. I have seen most of his videos. And personally also I know him. And my husband, Dr. Soundararajan, he's also have come here. And he's sitting there. I always say, there is a provision in the constitution. When the governor is attending a program, there is always a chair nearby for a Madam Governor. But Dr. Soundararajan always sits in the audience because he says, I also have found, most probably they would have thought lady governors won't be there. So there is no chair for a Madam Sir Governor. So always you would have seen governors will be accompanied by lady governors. But lady governors very rarely accompanied by their husbands because he always preferred to sit there. But in spite of that, because he was very much, he also very admires Dr. Mohan. And because of that, we came here. And I'm really happy that he is felicitated by the World Diabetic League. And what I have to say about Dr. Venkatraman, because he is, as Mohan, because as Mohan means it is diabetes, Venkatraman means it is hypertension. So these both diseases, preventable diseases, are now the most common diseases. And as doctors, we know that the awareness should be spread among the public. And whenever persons like Mohan or Dr. Venkatraman honored, it is the message to the people that they also should be very careful in maintaining their health. And I have to say, because the number of papers he has presented, a number of scientific papers published, actually it is really exemplary work. I don't know, when we calculate the days and hours he worked and the number of papers and the number of publications, I don't know per second how he works. Every second or I think it's very difficult to calculate it. So I'm really very happy, and it is shown that I also know his father is father of diabetes. So it is that it is not easy to carry the legacy also, I know, because everyone will say, no, there's so-and-so's father, so-and-so's son. So it is very easy, but I have had an experience. Because it is very difficult. It's not that father is father of diabetes, so he has acquired that habit of reading diabetes or learning diabetes, because the recognition is also very difficult. For example, because I am a politician's daughter, so when I used to go for elocution competitions, first of all, I will be graded as first person who did very well. And when my teacher introduces, usually my teacher introduces that, no, you know, it's so-and-so's daughter. Then immediately that judge will strike away my name. So if she is so-and-so's daughter, she would have done better. So always we have lost. So it is not easy to be a great person's children. It's very difficult because they are so great. So to reach that greatness, it is very difficult. So hard work is needed. So Mohan, definitely it would have been a very difficult because I can pulse it. So it is very difficult, but you have made it because his father is the father of diabetes, and he had his training under him. And I remember that I have met his father along with my father. And first time I saw in a clinic, apart from the clinic, there was a teaching room. So that is the importance of creating awareness among the public. I always say, whatever may be the disease we suffer, but awareness about the disease is more important. Not only the tablets or the medicine which we take, because awareness is very important. For example, when we were students at Tanjavur Medical College, we used to give iron tablets to the patients, identifying anemia in them in the pregnancy state. And when we go for lunchtime, most of the anemia tablets would have been thrown in the grounds. And we used to pick it up and we used to call the patients, why did you throw? Then they used to tell, no, already this is dark in color. My mother-in-law told, if you take this tablet, your child is also will be dark because it's black in color. So if you take the medicine, your daughter or son will be black in color. So I, in a lighter sense, I appealed the pharmacist for, so please don't produce iron tablets which is black in color. Please produce iron tablets which is colorful. So ladies do colorful saris and they are more colorful. So at least we will compel them to take because it's colorful tablet. Because making them aware, because awareness is very, very important. When I was practicing as a sonologist at Tanjavur, I asked one person, because that was the initial days of ultrasound. I asked one patient saying that I have to study your prostate. So tomorrow you come with full urine. Next day he came and opened a yellow bag, put one Horlicks bottle of urine, second bottle, third bottle. Then he told, no, you only told doctor, come with full urine. So I have got, so why I am telling this, making the people aware of the situation is the most difficult one. It's not the treating. And nowadays, having the Google by side, it is very, very difficult. So when we say some diagnosis, they will tell, no, sir, no, madam, Google says like this. So we have to compete with Google in making the people to understand. So nowadays they think they are half doctors. It's very easy to treat the ignorant people. It is very difficult to treat some people half intelligent or most intelligent or Google intelligent. It's very difficult. So we are facing with more challenges. It's not the medical practice which was just few decades back. It is very difficult. But in that situation, Dr. Mohan, because I know Dr. Mohan as a Sai devotee, and after meeting him, I became a Sai devotee. And he was telling me, because my name is Tamilisai Soundararajan. Hon'ble Prime Minister asked me, are you a Sai devotee? Because Tamilisai Soundararajan. I told him, Tamil Isai only. Somehow Sai blessed me. So Sai is with me. So he is blessing me. So he also told, so this is, most of the people, when I went to Telangana also, they pronounced me as Tamilisai Soundararajan. It's Tamilisai Soundararajan. So that affinity also, there we are devotees of Bhagavan. And I'm really very happy. And I have noticed most of his videos. And I have shared those points with some of the VIPs also. Recently, he told, now recently he has told, after eating, slow walk for 5 minutes. So that will prevent diabetes. These are small things, because small things which if we make the people to be aware. Because I always tell a small story. One farmer wanted to sell his land because he was starving and he was very poor, and he called an advertisement agent and he told, I want to sell this land. Without selling this land, I cannot thrive. So this advertising agent, you know how they used to write. He was writing, this is a piece of land which is near the railway station. Near the railway station, it will be 50 kilometers. It is near this school. And there are two trees, mango tree and guava tree all in the field. in the land, and there is a well in the Isan Mulai, that is Vastu, and everything he wrote, and beautifully written advertisement, and he gave it to the farmer and told, please give the fees for the advertisement. Seeing the advertisement, the farmer told, no, I am not going to sell the land. The reporter got angry. The advertising agent got angry. He told, just few minutes back only, you told you are going to sell this land, and without selling this land, you cannot thrive, you are poor and you are suffering. And now you are telling, after this advertisement, you are telling you are not going to sell the land. Then that farmer told, I don't know, such good things are there in my farm. After you make me aware because of this advertisement, now I am thinking why I should sell the land. So this is the situation. About our body, we know everything about our heart, stomach, everything, but alerting the patient, advising the patient, making them aware. Nowadays, I have seen it is making awareness is more important than treating the disease. I think Dr. Venkatraman also will accept it, because he's also have done lot of work on hypertension, and I think he's very cool. So only he's working on hypertension, and he's my neighbor. Because not here, it is he's my neighbor in Hyderabad. So I'm really very happy to attend this program. And Mohan is a role model, and not only treating. Most of our Indian medicine, we are unable to prove because it is not shared. Some good things, or even some of the our associated medicine, some of the herbal medicine also, which is really useful, it is not shared. Most of them say, no, this is our family property. But Mohan has shared his family property, the diabetes, to each and everyone. So I'm really very happy. So this type of awareness should be created by the physicians, by the medical fraternity, and the people really are benefited by your service. And I came here not only as a governor, I came not as a doctor, I came as a personal friend of Dr. Mohan, as well-wisher. And very rarely myself and my husband come to a program, because he will be practicing and I will be roaming here and there. And because of Mohan, we both on a Sunday we came. So this is a great compliment to you, and really very happy. So that more laurels. We are already having a long list. So if I wish, how the link list will be added. So whatever may be the situation, your service is needed for the society. And I really appreciate your service, and you appreciate now the social media, your awareness videos, and in the YouTube, your awareness programs. And I'm really very happy to attend this program. And with all my busy schedule, I'm really happy that I could make it possible. Thank you so much.